Hey guys, I'm Anthony Carey of Function First, creator of the Pain-Free Movement Specialist. I've got an exercise for you that in the Pain-Free Movement Specialist vernacular is more of a BC exercise, a little more towards the C. For those of you that have done this exercise, it's typically a little bit towards the end of your program. We call it the side-to-side lunges. And although this is a great exercise for loading up the hips and individually addressing or feeling it differently on each side and getting a good little inner thigh stretch, it's also great for us to be able to disassociate how the spine moves a little bit from the pelvis, and having that ability to kind of dampen or disperse some of the stresses that go on through there is a great thing for our body to have at its need during certain activities. So pay attention close to the little nuances of this, and you're going to love this exercise as a BC exercise. Okay, so what I'm going to use is the bench here in front of me. The first thing that I'm going to do is I'm going to separate my feet until I feel just a mild to moderate stretch on the inner thighs. I do want to feel a stretch, but I can't use up all the flexibility I have in my inner thighs because I'm going to get an increase when I go side to side. So the purpose of the chair in front of me, or bench in this case, is so that I can have my hands anchored. And then what I'm going to do is I bend forward and I've hip hinged. So what I want to be able to make sure is happening is the back of my skull is in a straight line to my tailbone, and it stays there throughout the exercise. So my arms, if it's a higher bench, lower bench, if I'm taller or shorter, I'm either going to bend my arms a little bit to get that hip hinge, or I'm going to stay a little bit taller. But I need to be parallel to the floor. So from here, what I'm going to do is I'm going to bend, in this case, this knee, and I'm going to slide over. And as I slide over, I want to keep my spine parallel to the floor. I get some pull in this inner thigh, but notice that I'm loading all the way into this hip. And then from there, I'm immediately going to shift to the other side, where again, I'm keeping my spine parallel to the floor. The tendency in something like this is for us to drop our butt too much, and then the motion becomes continuous. So again, spine is perpendicular to the camera. My arms are just kind of bending as needed to allow me to get to that position side to side. So I'm going to be really sitting into this hip as I get the length through this side of the inner thighs, and moving constantly, but in a smooth rhythmical motion. So one of the things that's happening here is that all the pelvis and even my center of gravity is moving side to side over the individual leg. So what you'll see is a tendency for the knee to want to flare out and the hip to rotate out as I move into this leg. We want to avoid that. One of the things that we want to see happen, even though my pelvis wants to shift this way, which is what we're making it do, I still want to see my knee travel over my toe. So that's actually causing a response or a reaction in the hip that we want to have happen as we load up that whole posterior back side of the hip here as we do that. So be very aware that there's a tendency for it to kind of travel this way, rock to the outside of the foot, knee flare out and rotate out. We want to come right through that so that we're effectively getting the pelvis to move around that thigh bone at that hip joint, and then it changes position again as we go there. So both movements side to side impact what both hips are doing as well. And one other advantage or attribute of this exercise is that if I'm flexed forward all the way 90 degrees of that hip hinge, what that does is it really puts a pre-stretch or helps us better load, which means get the muscle fibers turned on to the glutes and the posterior hip as we do that. So there's a definite reason. We can certainly do the same movement while I'm standing upright, but it changes the muscle activity around the hips when we do it. So we've got the disassociation from the spine, as well as the ability, as we're going side to side, individually really load up that posterior hip in an effective and a beneficial way.